Kechter from the UNA committee. I'm sort of looking after the portfolio of international health. Just a little bit to myself. My name is Pamela, as you probably can hear from an accent. So I'm German background, been here for the last 11 years. And today I'm going to be talking about my experience at the World Health Organization in Vietnam. I've done postgraduate studies at the University of City in public health, finished in 2010, early 2010. And in 2011, end of 2011, I had the opportunity to participate in a program in Hanoi at the HIV/STI office at the World Health Organization there. And today we'll be talking about that Treatment 2.0 project, which was rolled out in Vietnam in 2011.
I can't close it.
And this is the office that I was working at, and this gentleman on my left was my supervisor. He's Brazilian, Dr. Fabio Mesquita. So that's a little bit to myself and to the project I was involved in. I'm just gonna, I put a few photos together for you to enjoy. So I just open up the slideshow and you can just have a look. There's random pictures about Vietnam, about the office and people, places. So please enjoy while I sort of go through and talk to you about the project. So in 2010, at the International Health Conference about AIDS in Vienna, UNAIDS and the WHO, they agreed to this project called Treatment 2.0 in Vietnam, which at that time and still is a very new response to HIV/AIDS, and the treatment, it's very innovative and efficient and sustainable. So that new form of intervention was based on 5 pillars. The first pillar is optimized drug regimes, provide the provision of point of care treatment, cost reduction, service delivery adaptation, and community mobilization. So Vietnam is one of the few countries in the world where HIV/AIDS is actually a concentrated epidemic. That means that only a few people would actually be able to attract that virus, that are sort of, either they are drug users, a big component of people with HIV/AIDS are addicted to drugs, men who have sex with men, and female sex workers. So out of those 3, the group of 3, the people that inject drugs are the majority of people that contract the virus. The first case in Vietnam was sort of discovered in 1990, and ever since then it actually has spread among those 3 key populations. And as I said earlier, a large amount is actually related to the drug use, 70%. In September 2011, nearly 200,000 people were living with HIV in Vietnam, and 47,000 out of those 200,000, they actually had contracted AIDS. So there's a difference between HIV/AIDS, the infection, and AIDS. Not all the people that have contracted the virus are actually deemed to have AIDS. So only like 25% of those 200,000 people actually have AIDS. And 51,000 out of those 200,000 actually they die due to complications from HIV/AIDS related diseases. So Vietnam was actually very much committed to that Treatment 2.0 project. Leaders from the Vietnamese Administration of HIV/AIDS Control, the abbreviation for that is VAC, they basically led that initiative when it started in 2010. And prior to 2010, they actually had already worked on a system of integrated care. So that was not to the Vietnamese government. It wasn't something new, but it was something that that was very attractive to them because it came with a lot of funds from the UN, from the WHO, from other donors. So for them to put up their hands to be part of that pilot project was very attractive. And also that proposal came in time of the general consensus amongst the key stakeholders. So that was a really good time for them to get on board on the train and to implement their treatment 2.0 and also to promote the country's ownership and sustainability. And at that time as well, the media attention was pretty big around that topic because not every country gets that attention from the UN and from the WHO. And obviously the Vietnamese government was very proud to be part of that, and that momentum was very good, and it's until today and even like in the next couple of years. So they really wanted to be part of this project. That's why Vietnam was the government was a driving force. Vietnam is a country that sort of borders Laos, Cambodia, and it's very long. I've got a small map here, so we've got Vietnam is the country that sort of got this purple line around it. So as you can see, it's very long. And the pilot project was done in 2 provinces. One in the north, bordering Burma, and one in the south, bordering Cambodia. So as you can see, very 2 different provinces. One in the north is very mountainous, and as you probably, as you are aware, it's in the Golden Triangle. If you have you heard of the Golden Triangle? It's yeah, that's a hotspot in Asia where they have a lot of opium production, and it's probably also where the world's most heroin sort of coming from. So in the north, it's very much mountainous region, and it's very difficult to access health centers and community centers up in the north. South is very different again. It's close to the waterways, so you've got a lot of movement going around on the boats and the ships. So those 2 provinces were chosen by the Vietnamese government to be part of that WHO project. And as you can imagine, that province in the north is called Dien Bien. And Dien Bien, because of its location of being in the Golden Triangle, that epidemic is actually going on for much longer than in the south, because obviously they've already been having the problem of people injecting drugs for much longer than in the south. The population is evenly distributed amongst those 2 provinces. So again, that's why they were quite attractive to the government to choose, because the population, the sample size is approximately the same. However, the geographical location is very different. So that made it very, very attractive. So, and obviously, an approach like this had to be staged over a couple of years. So in 2010, they had this conference in Vienna, and a year later, that's when they started to actually assess the situation in those 2 provinces. So in July, August 2011, they started with the assessment approach. Then the planning phase was scheduled to be between September and December 2011. Implementation was then anticipated to be between February and November 2012, and the evaluation process then from November to December 2012, so which ended last year. When I was there in October, November, and first week in December in 2011. So that meant that I was part of the planning process. So the assessment was already done, and that's after the assessment phase, then the planning phase started, and that's where I come in as well. Initially, an assessment is very important. Whenever you want to assess a situation or a project, you actually have to do a bit of groundwork before you can get started. So what the Vietnamese government did, the WHO, UNAIDS, and PEPFAR. PEPFAR is an acronym for the President's Emergency Plan for AIDS Relief. It was initiated by George W. Bush a couple of years ago. And they're very powerful. They are handing out lots of money to different countries with different AIDS-related projects. So PEPFAR is a major donor to the project in Vietnam. So they started out with a desk review. What it meant is that they collected data from those two provinces through the monitoring and evaluation system and surveillance and case reports. So basically they gathered information that's necessary to get their project started. And then obviously after the desk review you also have to do field visits. So representatives from UNAIDS and WHO and the Vietnamese government, they actually traveled to those two provinces. And they looked at existing HIV/AIDS programs, health system infrastructure. They met people from the community, from those three groups I mentioned earlier, from the men having sex with men, from the female sex workers, and the people injecting drugs, just to understand the barriers and the situation, and to get a feel for it of how things are currently working in these communities. And they definitely have to also talk to the people that are on the ground, health workers and clients, just to understand the local context. Because obviously it's never easy for organizations that have foreign representatives to go to a province somewhere in the jungle of Vietnam without actually having an idea of what's going on the ground. So very important that they do that field visit. And then after that the planning phase started. Again, I mentioned September 2011. During that phase, collaborations with the major donors was very important, with international and national non-government organizations, key populations at higher risk, health professionals, government officials, law enforcement agencies. As you can imagine, that people who actually are taking drugs, they don't have the police on their side, so it's actually a criminal act to take drugs. I will mention that a little bit later as well. Vietnam is not considered as a poor country anymore. It's actually now reached middle income status, which means that it has already experienced and it will in the future that support is being reduced because obviously it's now reached a different level. Support from international agencies is going to come to an end very soon. So that's why it's very important for those partners to work together to implement an effective program that can actually be carried on the next couple of years, so that they're not reliant on foreign aid anymore. Various partners have different skills and expertise. The WHO is a very, very good agency that has a lot of technical expertise. They're very much evidence-based, which I can definitely sort of say, because these people that are working there are really experts in their fields. Fabio Mesquita, the gentleman that you saw earlier, he's from Brazil, and when he started, he's a medical officer by background. When he started out in the late 80s, so he basically dealt with the first case of HIV/AIDS in Brazil. So he's been on the forefront of HIV/AIDS STI for a very long time, over 30 years now, over 30 years. So his level of expertise is amazing, and so is everyone else working there. So you can definitely say that the WHO is a think tank in global health. And then I mentioned UNAIDS. So UNAIDS is a United Nations organization that purely looks at AIDS, and they've also got a lot of funding. Their expertise is now more in community mobilization, HIV prevention, stigma, discrimination, and elimination. So obviously, as you can imagine also, those people that are carrying that virus are very much discriminated by the families, by the friends, by the communities. So it's very important to actually target that issue and help to overcome those barriers. So this is now the expertise of UNAIDS. And again, very important for those organizations to work closely together, because UNAIDS would not have the technical expertise that I mentioned WHO has. And then obviously another very important point is to not only have the technical expertise and the community engagement, but also involve the key stakeholders in there. So I mentioned those three groups earlier. Very important to get their opinion, their feel for it, because there's no point in implementing and trying to target one health issue if you don't get those people on board that actually been affected by a particular health problem. Obviously, there's great fears related to protection of confidentiality, stigma, lack of perceived risk. Some people are very educated, so they don't even know what it means to be infected by that virus. So, and to what it means to actually carry that diagnosis of HIV/AIDS. So that's why the big problem in Vietnam is actually to get those people tested. That's a very, very big problem, and for that you need to go to the community to convince them that it's not a bad thing to go to the health center and have yourself tested. Because what happens if you don't know about it? It's very easy to spread to other, to your wife, to your girlfriend, to other people that are close to you. So very important to activate the community to sort of get people started to talk about that issue. So I mentioned the 5 pillars earlier. The first one was optimize drug regime. So the WHO has guidelines in place for when you should, or when a person anywhere in the world should get tested for when they want to know whether they're HIV/AIDS positive or negative. And a normal healthy person would have between 500 and 1,000 let me say 500 to 1,000 cells per cubic millimeter. That's a healthy range, 500 to 1,000. What happened in Vietnam is people get tested that have less than 100 cells per cubic milligram, so which is very, very low. Not quite sure whether you understand, but the white blood cells are very important in your body to fight infections. So when you've got a cold and the flu, so the likelihood that your body is fighting an infection means that the cells are actually less than 500, between 500 and 1,000. So people that actually contracted the virus, they only have a few hundred left. So in Vietnam, they get tested when they are less than 100. WHO says the standard should be 350, because when you have less than 100, you're already very, very sick. That means you're already suffering. You've already got flu symptoms. You feel very, very tired. So basically, the problem is that people get tested far too late in Vietnam. So the WHO is now encouraging the Vietnamese government to introduce measures to have them tested when they still have 350 cells per cubic millimeter, because then they're not as sick as they are when they only have 100 left. And the other point, the second pillar I mentioned, is the point of care treatment, which is like a simplified treatment. Right now in Vietnam, they actually have a system that's laboratory based. So if you wanted to get tested, you have to go to the lab and undergo that testing there, which then means that you will have to wait 2 to 3 weeks to actually find out the result. And as you can imagine, in the north, where it's very mountainous, it's very difficult and encouraging for someone to walk 100 kilometers across mountains and through provinces and have themselves tested, only to go back again, wait for 2 or 3 weeks, and then go back to the health facility and to find out that they're possibly HIV positive. So that's not a very good solution. So what Treatment 2.0 is trying to implement is the rapid testing machines. I found one on the internet and I thought I would print it off. So this is like a device that's probably very easy to carry, very sophisticated. And that device actually spits out the results within minutes. Okay, so that's a very effective way of testing people that may think that they're HIV positive. So so that's the second pillar. Very, very important, because obviously a major barrier is not only the effort that people have to make in order to get to the testing facility, but also, again, I mentioned the stigma and the not knowing. which is also a big problem. And obviously the third pillar is a cost reduction. Everything is getting very expensive now these days. So even in Vietnam, they were trying to reduce the cost in order to maintain that project for much longer than just 1 or 2 years. So what this treatment 2.0 is aiming to is to actually get people started earlier, and not only at the district level, but also at the provincial level and the community level. So basically what it means is to reduce stigma and the fear much earlier, because what happened then is they actually get other diseases as well. Like when you're already sick and your immune system is very low, you attract other diseases. And such as hepatitis, for example, needle sharing always goes along with other comorbidities and infections. So people that actually using drugs are very much also having hepatitis and heart diseases, lung diseases. So the earlier you get in and test those people, the sooner you can also treat those comorbidities and other diseases that people have. And the fourth pillar is to streamline all those health services, because it's very important to sort of implement and include those rapid testing machines, for example, into the health system in Vietnam, because there's no point in isolating those techniques and treatment efforts and have a separate approach to them other than the general health system. So it's important to centralize those efforts and make it more affordable and accessible for everyone, rather than have them spread out across different geographical locations. And lastly, mobilize communities. As I said earlier, very important to actually talk to people on the ground, to people that actually have HIV/AIDS or that are using drugs, and involve them in that setting, because these are the populations that benefit the most from all those techniques that the WHO and UNAIDS is trying to implement. The early progress and challenges in relation to the Treatment 2.0 project is actually the high-level government commitment that Vietnam showed is very much a good indicator for the success of that project, because that project has been very critical to the Vietnamese government in order to not only secure the funding, but also, as I said earlier, to keep that momentum going. And they have a really, really good country leadership and ownership that they not only have demonstrated in the past, but it's likely that they're going to have it in the future as well. And the two planning processes now have gathered around 120 people in each community. So as we speak, they already have 120 people in both provinces that are participating in that project. So obviously this is good news, because obviously once you have a project succeed in two provincial areas, the likelihood that they're going to spread that message to other provinces is quite high. So Vietnam has 64 provinces. So there's a few more provinces to go. And but obviously in saying that, there have been a lot of challenges as well. That requires a large way of thinking, and the shift in the way they're currently thinking and the way where they're trying to head. You have people that are sort of thinking that the quality of that rapid testing is not as good as the laboratory way of testing. So they have to be convinced that these machines are actually doing a good job and they're actually giving you the right result and not the wrong one, because otherwise they don't want to sort of obviously disappoint people. So there are a few barriers that are still in place that have to be sort of addressed gradually. Then you will have to train the health workers. No one has seen this kind of rapid testing machines work with them, so they need training and capacity building. They need to know how to operate that. So there's a lot of work to be done still, and you have to then combine that diagnosis with antiretroviral treatment. Antiretroviral treatment, or ART, short for antiretroviral treatment, has been proven to be very effective. So once someone has been diagnosed positive, they should be getting ART treatment. Very important to start early. Again, it's got something to do with the white blood cells that are in your bloodstream, in your body. So the lower the rate there, the more difficult it is for the treatment to be effective. And then obviously there has to be a behavioral change as well. Just because you've got the virus doesn't mean that you're a bad person or that you're a bad husband. That gradually it will have to happen that the fear level has to be reduced, and the stigma as well. If you have a son or daughter or brother or husband that has contracted the virus, is still part of your family. So a lot of people actually think that once other people find out that they have the virus, they're actually going to be expelled from the family and community, which is happening, and that's why they're so fearful to have themselves tested. So it's a very, very scary kind of thing to have, I guess, if you're in a very tight-knit community where as soon as you're a bit different, you're going to be expelled. So there's a big fear factor. And then, as I was saying earlier, talking about the law enforcement, obviously taking drugs in Vietnam is forbidden. If you get caught, you will be locked up in a not in prison, but it's a kind of prison. It's like a rehabilitation center, and it's very much controlled by the law enforcement agency. So, and again, it's got something to do with the Golden Triangle, because obviously they know that it exists, and they know that people trafficking drugs through this triangle. So they're very harsh. The penalties are very harsh. So. WHO is always in contact with the law enforcement agencies, with the police, with other national, international bodies that trying to capture those people. So again, from a health point of view, you have to help people that have a particular health problem, such as HIV. And the law enforcement agencies, they want these people because they have done a criminal act. So it's very important those two agencies work together. And it's not always easy, and that's what I mean by trying to encourage a shift in the way they think. Because obviously, whether you take drugs or you men having sex with men, whatever it is that they did to contract the virus, does not mean that they have to end up in prison. So there's still a lot of work to do, but it's getting better, because they have gotten a lot of support financially and technically, and that Treatment 2.0 project has definitely gathered momentum to be able to sort of spread that message to other provinces and to other countries, for that matter. So to sort of bring it to an end is, again, Vietnam is one of the few countries that sort of enjoyed that level of expertise and financial support, unlike any other country. So Vietnam is in a very, very good position to carry that on, that message on to into the future. However, important is that they actually take everything into account that the WHO and UNAIDS already put in place. It's important to integrate those rapid testing machines into that current health system, and not isolate that from anything else, because obviously if you have treatment facilities in isolation to the general health system, it's not very attractive to people to the community on the ground, because obviously they don't feel like they get the support that they need. So and then we have to train the health workers. What I did as part of the project that I was involved in, the small project, as part of the planning phase, was to actually compile training material for peer education workers. So the best people to train someone who's already got HIV/AIDS is the people who've got it. So we organized workshops for people to educate their own peers. So very important to encourage the peers to talk to their own people to get tested. So obviously in Vietnam you have a lot of local languages as well, so not everyone is fluent in reading and writing and even speaking. So a lot of dialects that some other people in other districts won't necessarily understand. So you've got the language barrier there as well. but as I said, you just have to work around with pictures and translators. And so that's the part that I was involved in, joining the assessment phase. We did training for the peers and organized the training workshops in those two provinces. Yeah, so that project has now sort of come to an end, and it was deemed as very successful. The most important thing is that Vietnam has now the obligation to make the best out of it, so to speak, because obviously over the next couple of years, PEPFAR, this is the President's Fund for AIDS, is going to reduce the cost significantly. So they're not going to be handing out money just like that. And AIDS has been getting a lot of attention over the last 10, 20 years. In fact, they've got their own UN body. Tuberculosis or hepatitis or malaria haven't got their own UN bodies, so HIV/AIDS and AIDS has been getting a lot of attention. So, and this eventually will run out because obviously we've got non-communicable diseases like heart diseases, lung diseases, diabetes, which is on the rise as well, even in low-income countries and developing countries. So you've got other diseases that are now starting out to be actually a big problem as well. So AIDS may not be getting that attention that it enjoyed over the last 10, 20 years. So that means that funds will not become available anymore. And even when I was there, they had significant difficulties and problems to actually get that necessary funding. So Vietnam really has to sort of keep that momentum going and incorporate that into their own health system, because otherwise they're going to miss out on a great opportunity. And yeah, but it's on track. It's like with everything else, you just have to work collaboratively, because they've enjoyed a great deal of collaboration. And yeah, so it was an exciting project. It's very good to see highly motivated people working together for a common goal. And that was definitely an experience that opened my eyes in terms of like, obviously how problems are being dealt with in other countries. And I've been to Africa as well, and then to compare those two epidemics is very different. And it's very much true in Vietnam that it's more concentrated, but it's not, but it's as equally as important as in sub-Saharan countries where you have more people infected due to different reasons. And the likelihood that in Vietnam are people going to be sort of put aside because they're doing something that's illegal or that's something that you shouldn't be doing means that they're not going to get that attention, unfortunately. So it's still a big stigma, and yeah, it's not a good thing to do, to be exposed to that kind of environment that actually causes so much grief and stigmatization. So yeah, and these pictures are just taken from randomly went to the rice paddocks and to the north of Vietnam. So it's a beautiful country. Food is very beautiful as well, very healthy, as you can see. When you go up into the countryside, you've got kids playing around. It's a banana flower. Rice paddocks, so you've got people working, up at 1,000, 2,000 meter high peaks. So it's a nice country. It's a very, people are very friendly. So it's definitely one of those countries that are going to be opening up their borders to tourists also very soon, because it's they've got a lot to offer. To put those health issues aside. But yeah, so I think I'm sort of. I'm at the end. Let's just see what the time is. But yeah, so opening up for any questions,
Yes.
and I would be happy to answer anything that you think.
Thank you, Pamela. Thank you.